Okay, so this is my factor 2 deficiency project, or also known as Prothrombin deficiency. This is by me and Ashton Fitzgerald and Logan Stowell. What is it? Prothrombin deficiency is a disorder caused by the lack of protein in the blood cell called prothrombin. It leads to problems with blood not clotting enough. You can get it through birth or a blood transfusion. Blood clotting normally occurs when there is damage to a blood vessel. A day in the life of. A person with factor 2 deficiency lives a normal life. It only affects you if you get an injury. How do you get diagnosed? Diagnosis is made with a prothrombin time test (PT) and an activated partial thromboplastin time, also known as APTT test. How many cases are there? Factor 2 deficiency is a rare, inherited, or acquired bleeding disorder with an estimated incidence of 1 case per 2 million population. Accordingly, they usually have either little prothrombin or a near normal output of dysfunctional prothrombin. Who does it affect? It affects anyone that has both parents as carriers, and you can also get factor 2 deficiency from someone who has the disorder and does a blood transfusion with you. Symptoms. Uh, one symptom is umbilical cord bleeding at birth, unexplained bruising, abnormal bleeding after giving birth, having surgery, or being injured, prolonged nosebleeds, bleeding from the gums, or heavier or prolonged menstrual periods. Prognosis. The outcome is good with proper treatment. Treatment. Treatment of factor 2 deficiency is aimed at restoring circulating factor 2 to levels sufficient for homeostasis. Levels greater than 30% of normal are usually adequate. If the person has the disorder bleeds longer than 15 minutes, then they are rushed to the hospital for a plasma transfusion. Foundations. The best foundation that helps with factor 2 deficiency is the National Hemophilia Foundation, also known as NHF. They are dedicated to finding better treatments and cures for inheritable bleeding disorders and to preventing the complications of these disorders through education, advocacy, and research. That was my presentation, and I hope you like it.